I've got Nicole with me today that has been working on this chair for a very long time. She's a physiotherapist with great knowledge about the function of the pelvic and how to treat pelvic dysfunctions using the pelvic power. Since the London Olympics 2012, cycling has taken off extreme in the UK. Groups of people get together in the evenings, weekends, commuting to and from work on the bike. But we are starting to see a lot of people that are sitting on a very hard bike, carbon frames, little saddles, and the pudendal nerve is at risk. We are seeing the same in young ladies actually that does horse riding as well. So we're pushing on that pudendal nerve that leads to a whole range of symptoms. Will you comment a little bit on that, please?
Yeah, so I'm a horse rider myself, so this sits close to my home, to my heart. And also with we see that, and a few people have come out and talked about it in cycling. There is a huge increased risk of problems with erectile dysfunction if you are putting pressure in that area. And I think it's something, that people just are not talking about because men don't want to talk about erectile dysfunction, even though it is really, really common. I have people in clinic who are saying, they've been on the golf course and they now don't want to go on the golf course because they're worried about leaking. Or they're saying, that they feel less of a man because they're not able to maintain an erection. Some people don't see the link between cycling and erectile dysfunction. And I want to be really careful here because actually cycling can be very good for your health, can reduce your risk of heart disease, cancer, stroke. So we don't want to be saying, no, don't do exercise. We want to be saying, well, what things can we do? What can we change to try and help people feel more comfortable and also to treat some of these symptoms? So certainly with cycling, it does increase the risk of erectile dysfunction, and that's all to do with blood flow, and like you quite rightly said about the nerve. So how does Pelvic Power help with that? Well, when we're using high frequencies with Pelvic Power, is we're going to increase the oxygen in and around those areas. We're causing contraction and relaxation. We're improving the oxygen. We're relaxing some of the muscles that are tight. So with erectile dysfunction, a lot of people don't realize that muscle needs to be relaxed to get the blood flow into the penis. So if we can cause relaxation of that, that's going to help. Sometimes as we age, naturally over the age of 30, actually we can start to lose muscle bulk if we're not training. So we're also trying to think, right, those specific muscles in the pelvic region, how do we strengthen those? And that's more the kind of the older man who may be finding that they have just got weaker sort of over time. If it's a younger man who's doing lots of weight training, the first thing I'll think when they come in is I will look and I'll think about those higher frequencies.